And welcome back to the WHHI Daily News. Wendy Cummings has joined us once again. As you know, she is a school nurse with Cross Schools, and it comes on our show every month to give us updates and tips and advice about our health. And we're going to kind of change the format a little bit today. We're going to do a true and false, and she'll answer the question and explain. So the first question is, Wendy, the flu vaccine can give you the flu, true or false?
That is false. Contrary to popular belief, you may get some symptoms of the flu, but it does not actually give you the flu. It is what we call a dead virus, so it is not going to give you the flu.
Okay, very good. Next question. Flu symptoms can include fever, cough, sore throat, and body aches, true or false?
That is true. It may also include some nausea and vomiting, diarrhea, especially that's more prevalent in children. But those are the most common and most popular symptoms.
And this is a good question because I have no idea what you're going to say. You can only catch the flu once during flu season, true or false?
Okay, that is false. There are multiple strains of flu, and you can get the flu multiple times in a year. You can also have COVID and flu at the same time, or other viruses on top of it. Sometimes we'll see back-to-back flu and RSV. So you can catch that. That is false. You can get it more than once.
Okay. Antibiotics are effective in treating the flu. Antibiotics are effective in treating the flu, true or false?
That is false. Flu is caused by a virus, not bacteria. So antibiotics are not going to be helpful. Now, if you get a sinus infection or some other bacterial infection as a result of having the flu or kind of a side effect of the flu, then antibiotics might be helpful, but not for the flu itself.
Okay, our next question. The flu can be spread by coughing, sneezing, and even just talking.
This is true. Spread via droplets. So that is true. That is why, well, I won't give away the next answer. Well, actually, I'll give away the next answer. Okay. The next answer, can washing your hands frequently help prevent the spread of flu? And that answer is true. And that's why, because it's spread through droplets, we want to keep our hands away from our mouth. Also, eating and drinking after one another can also help spread that.
Okay, very good. Now, our next question, Wendy, is the flu is only dangerous for the elderly and people with weakened immune systems. True or false?
So if you took out, I think it says not just the elderly, it can be dangerous for anyone. It is more dangerous for the elderly and those with weakened immune systems, children as well. So while for the normal person, it may not be, and they may just get a brief illness, it can be dangerous for elderly, children, and those with weakened immune systems.
Okay. And then you should stay home for at least 24 hours after your fever is gone without the use of fever-reducing medications if you have the flu. True or false?
That is true, and as school nurses know, that is something that we tout for every illness, fever-free without fever-reducing medication for 24 hours. And also just your child being well enough to participate in school.
Okay, and then we just have two more. The next question, getting the flu shot every year is necessary because the flu viruses are constantly changing.
Yes, viruses do adapt and they do change and mutate. So that is why encouraging to get flu vaccines each year. It is not necessary. You don't have to get the flu shot. Many people choose not to. That is a personal decision that I encourage everyone, both for themselves and for their children, to speak to their personal healthcare provider and make that decision very informed.
Okay, and our final question, Wendy, the flu can lead to serious complications like pneumonia and hospitalization.
That is true, and that is true of especially children, our elderly, and those with weakened immune systems. And that is why it is best if you, during the flu season, if you fall into one of those categories, we encourage you to get the flu vaccine. Stay home if it is highly prevalent in the area that you're in. and just take all the precautions that you can to stay healthy.
Thank you so much, Wendy Cummings with Cross Schools, our monthly update, health update. Thank you so much, Wendy. Appreciate it.
Thank you.
And we'll be right back with more news. Don't go away.